All right, it's time to get your questions answered from Dr. Zorba Paster. We'll start with Mary in Janesville. Hi, Mary.
Hello.
Hi, what's your question?
Since your pets and zoo animals can get corona, what about mosquitoes?
Well, first of all, we're not really sure that animals get corona. We know that a tiger got corona in New York City, but we really don't know if that's a fluke or whether or not animals can actually get corona, the coronavirus that affects us. Animals do get other coronaviruses, but not COVID-19. As for mosquitoes, the answer is no. Mosquitoes do not carry COVID-19.
All right.
Of course not.
All right.
All right, just when we were feeling hopeful about that. Let's go to Donna from Lake Mills. Hi, Donna, what's your question?
Hi, I have COPD, and I'm wondering, in reference to the coronavirus, can this be more serious if you get the virus?
Absolutely. If you've got chronic lung disease, diabetes, heart disease, hypertension, anything that makes you much less likely to be able to mount a robust immune response, it's going to make a difference. And anyone with COPD is definitely at a high risk, and that means you've got to be really as good as you can about self-quarantining and social distancing.
All right, Donna, take care of yourself.
Yeah, be careful.
All right, let's go to Michelle from Deerfield. Hi, Michelle.
Hi. If you are asymptomatic for COVID-19, would you recommend sanitizing, washing your toothbrush every day?
Oh, good question.
Well, first of all, we don't know who's asymptomatic for COVID-19 because we don't have an antibody test. So we don't know who exactly is symptomatic or not. But if you use your own, if you have COVID-19, let's say you're symptomatic and you have it, you actually have to keep everything away from everyone else. So it's your toothbrush, it's glasses, it's your clothing, because once again, we really don't know exactly how it's spread, but we know it can be spread with inanimate objects. So the answer is yes, you've got to wash everything, but more or less you've got to keep it away from everyone else, as well as if you're asymptomatic. But of course, we don't know who's asymptomatic and who isn't because we can't test for it.
Right, that's the most challenging part
really
of the
is.
whole thing. Let's go to Karen from Keeler. Hi, Karen, what's your question?
Yes, I was just wondering, these patients that are in the hospital and do they go into a coma on their own, or are they induced?
Well, what happens is if you are very sick with COVID-19 and then you have to be put on a ventilator because you can't breathe enough, when you're put on a ventilator, you have to be sedated because ventilators are very, very uncomfortable. You have to have a tube down your lungs. And at that point, you're put into what's called either conscious sedation or a very low level or a very significantly very low level of sedation. So you're sort of induced into what we would call a coma. And that's the point where you're really not thinking, you're in a dreamlike state, and that's the only way really ventilators work. As soon as you start to breathe with a ventilator, usually you're getting better, and that's often the case where you're beginning to have a lighter sedation.
All right, let's go to Carrie in Watertown. Hi, Carrie.
Hi.
Hi,
I
what's your
have
question?
COPD, and I just had a stress test done today, and it came back abnormal. I'm wondering what that could mean.
Oh, it can mean a lot of different things. It could mean you need cardiac catheterization. It could mean that you need an echocardiogram. Abnormal stress test can mean a lot of things. This is a good time to call your doctor, certainly tomorrow, and say, hey, I've got an abnormal test. What does it mean? What's the next test that I may have to do? Lots of questions, difficult to answer on the air.
Yeah, and Carrie, be well. Let's go to Don from Sun Prairie. Hi, Don, what's your question?
Yeah, I was just hearing about somebody else has COPD. I have it, and I had double lung surgery. They took the top third of my lungs off. And I'm just wondering that when I read something in the paper that said there was some kind of a thing in your genes that Corba feeds off of, but people with lung problems don't have those, they have a lower risk of getting it. I've been in my house for over 2 months, 3 months, that I'm afraid to go outside. I don't want to get it.
Let me tell you something. You are not at a lower risk. You are at a very high risk of getting it. And if you get it, you're at a very high risk of dying. So that is, whatever you read about saying a lower risk, that is 100% wrong. Anyone with lung disease is at a higher risk for COVID and at a higher risk of getting death from the coronavirus. So stay safe, stay away from others, self-quarantine.
Yeah, he's been in the house for 2 months. That's wise.
Yeah.
All right, let's go to Lori in Mount Horeb. Hi, Lori.
Hello?
Hi, go ahead.
Yeah, I'm wondering. I have a friend that 2 weeks ago got bit in the stomach with a tick. And we've been trying to treat this with the doctor for 2 weeks now here. And it does have a little bit of red. And we've had it in 2 antibiotics, and the doctor will not pull out. There's a very little left, and they won't pull it out. What do you suggest we do?
Okay, this is not corona
Pull it out.
related. Pull it out.
It's not. Yeah, just pull it out. Take a tweezers
I have been
and pull the thing
digging.
out. That's what I would do.
I've been trying to dig to get it out, and the doctor, we can't get it to release the little bits left, and the doctor won't do nothing.
Well, first of all, they may not do anything because of COVID, but in fact, whatever is left in there, if the person has been treated with antibiotics, whatever's left in there is really not an important issue because it's been a long time. The tick is dead, and the reality is the antibiotics are really what mattered. So I don't think I would try to pull it out, but if it doesn't come out completely, eventually the body will get rid of it.
Maybe that's what's making it red, all the agitation.
Yes.
All right, we're out of time. Thank you all for calling in. We'll do this again next week. Zorba, thanks.
Zorba, thanks for your time.
Stay
Great
well.
to see you.
Stay well, stay safe.
You as well.